Hello there, it's Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today's show is going to be a really special one because I'm so excited to interview actress Jennie Garth, who skyrocketed to fame playing Kelly Taylor on Beverly Hills 90210. Jennie recently revealed her diagnosis of osteoarthritis, and she wanted to raise awareness for this disease, including caregivers with osteoarthritis, so more people could get the treatment and care that they deserve. The timing could not have been better because May is National Arthritis Awareness Month. According to the CDC, arthritis is one of the most common conditions in the United States and a leading cause of disability. Nearly 60 million adults have been diagnosed by a doctor with arthritis, which is inflammation of the joints. Two common types of arthritis include rheumatoid arthritis and osteoarthritis, or OA, which will be the focus of today's show. OA is the most common form of arthritis. A degenerative joint disease, OA causes wear and tear of the joints, most commonly in the hands, hips, and knees. The most common symptoms of OA are joint pain, stiffness, swelling, and decreased range of motion of the joints. So right now, let's hear more about Jennie Garth's journey with osteoarthritis.
So first of all, and by the way, in addition to writing for Forbes, I'm an internal medicine doctor. I specialize in addiction medicine, but I've also served as a medical contributor for MSNBC and NBC News. And so it's a real passion of mine to merge my passion for medicine with media and entertainment to reach a larger audience. Yeah. So again, thank you for doing what you're doing. And my first question for you really is, to the extent that you're comfortable, can you share with us a little bit about your journey with osteoarthritis, maybe when you were diagnosed and maybe some of your symptoms, again, to the extent that you feel comfortable?
Yes, of course. I, a few years ago, started feeling a different feeling in my joints, some stiffness, mostly stiffness, and an aching that just after I would bend or when I would bend, just didn't feel like it usually felt. So I went to the doctor and had an x-ray done, MRI done, and through those mediums, they were able to see that I had the early stages of OA, osteoarthritis. And I was like, what? No, no, I don't, you're reading that wrong. And
Yeah.
they kind of laughed at me. I'm like, no, you do. And I said, but arthritis is for old people. I'm not old yet. Don't give me that.
Exactly.
Exactly. Yeah. And they said, no, actually, in fact, it's for any age person, young, medium, old, and dogs can have arthritis. Like everybody can have arthritis.
That's true.
It was kind of like a shocker for me because it does carry a stigma in my mind of something that older people are challenged with. So just sort of grappling with that and coming to terms with it and giving into it. From that point on, just finding ways to alleviate the symptoms and learn to live with it, learn to combat it, learn to prevent it from getting worse. So through diet, through exercise, through pain relieving gel that I can take in the moment, like the Voltaren, that does help so much alleviate the situation. So that's kind of my journey, really.
Yeah. Well, thank you so much for sharing that. So it sounds like your predominant symptoms were joint pain, maybe some stiffness, and which was it in your knees, wrists, elbows, which joints?
Well, it started in my hip, and then I started noticing my knees and my hands a lot because I use my hands. Well, we all use our hands so much. So, and they're so delicate. Yeah, there's so many little joints in there. So that's where I started to feel it most.
And you pretty much kind of led me into my next question, which was really what sort of things brought you relief, symptomatic relief? I think you started talking about some of your diet, other lifestyle changes, and medication. So share with us what things made you feel better.
Well, what makes me feel better is, first of all, stretching, moving. It seems like mentally, it tells me I shouldn't move. I don't want to move because it hurts. But the reality is when I do move, when I do stretch and continue to stay active, it actually makes it better. And I know that over the long term, that's going to benefit me, just staying agile and flexible and having it all moving and flowing. And the other thing in the immediate was using a pain relieving gel, the Voltaren, that really targets it and really penetrates into the joints. And I find out that helps. Since I started doing work with Voltaren, I realized that my mom uses it, my sister uses it, my trainer uses it the other day. He whipped it out and offered me some. I said, hey, I know that product. And then also another thing that really helps is diet. I've always been a super clean eater. I attribute that to being healthy. I live a very clean lifestyle. I don't smoke, I don't drink. And I just eat a lot of fruits and berries and nuts and grains and no dairy, no meat, no super inflammatory things. The only thing that it's hard for me is the sugar. I've always had a sweet tooth. I love to bake, and I like my sugar sometimes.
Can I tell you something? I have the world's biggest sweet tooth, and I think I inherited it from my dad.
Me too.
I'm not going to fault you for that at all.
Okay. This will be our little secret.
Yeah, I can even say doctor's orders. It's okay to have a little bit of sweets every day.
Yeah.
And I'm so glad you talked about, first of all, I'm you're absolutely right in that anything that's anti-inflammatory, such as the NSAIDs that you're using, like Voltaren gel, which is an NSAID or non-steroidal anti-inflammatory, can be really effective in reducing symptoms and bringing people relief to their symptoms. But you also mentioned something that I think I always share with all of my patients, which is really a healthier diet. Even making small changes can be really effective at improving your overall health. And in your case, it sounds like you're following a really good as you use the word clean, really nutritious or nutrient-filled meal plan. So, I mean, that's fantastic. I mean, you look fantastic. So that's really great. That's really wonderful. One of my other questions was, why did you decide to share your story with the public? I mean, some people, I've always considered health to be a very personal issue: mental, physical, spiritual, emotional, psychological health. But in your case, you decided to share it with the public. And what made you make that decision?
Yeah, I'm a pretty private person. I don't know. I just take my privacy very seriously, but there are certain things that I do like to shine a light on. And so when I started struggling with my own diagnosis and started working with Voltaren, I learned about the campaign that they're launching called Care Walks. And it really motivated me to become a part of it, because I saw it as a great opportunity to sort of shine a light and celebrate caregivers in a way that they haven't been seen before. I think at some point in all of our lives, we're going to end up being a caregiver, whether it's to our children, our parents, our animals, whatever it is. And so often those caregivers are overlooked. And, it's usually the focus is on the patient or the person that's ill.
Right.
And this is just an opportunity to recognize and celebrate caregivers, and to give them a platform to connect with one another and communicate and share their stories and feel like they're not in this alone. Because a lot of times caregivers are suffering through their own pain that they don't ever really talk about or, seek help for. And I think that reminding them to take care of themselves is a very important message.
Well, I couldn't emphasize that enough, actually. Again, both personally and professionally, when I think of my own family and when I think of my own mother and how she cares for my father, and both of them have chronic illnesses. And I think of so many of my patients who either take care of another loved one, and the personal toll that it takes, and they just kind of, quote, suffer silently. So I can't thank you enough then for really shining a spotlight not only on osteoarthritis fighting the stigma and misconceptions that I think many of people like you also have, like, oh, that's an old person's disease, right? And then also just shining the light on the efforts that caregivers put into this this whole process of just caring for other people. So thank you so much for doing that. And I guess my last question really is, as a very successful woman, an entrepreneur, and a proud mother of 3 amazing daughters, I wonder, what message do you have for girls and young women about their health and overall well-being?
Hmm. I have a lot of messages.
I'm sure you do.
Yeah. I would have to say, teaching young women about self-care is really important, physically and almost more important mentally, but it's all connected.
Yeah.
I feel like, especially now, there's so much pressure on our young girls and young people in general to be perfect and to live up to what they're seeing on their social media feeds. It's really, really hard. It takes a mental toll on them. And then they can start taking that out on themselves physically in different ways. So getting those messages out there to support them, to give girls, young people information, access to positive information and realistic, images and expectations for themselves is really, really important to me. And just the basics of teaching them how to take care of themselves and eat well and be safe, and
Yeah.
all the things. There's so many things, so many messages that I feel like that's why I was put on this earth, quite honestly, is to have my daughters and communicate to them the wisdom that I've gained in this lifetime or maybe before, and pass it along. So being able to use my voice and my platform and my position as a mom is really important to me.
So not only will I be sharing your story with osteoarthritis and your treatment with FORBS, but I'm going to share it on my own YouTube show series that I just launched. And in fact, every Wednesday is Women's Health Wednesday, and so I've devoted every Wednesday show to be about women's health. Your message will resonate very strongly. And so before we go, I thank you so much for talking to me. Are there any messages that you would want to give to medical professionals like me, and is there anything else that maybe I didn't ask that you'd like to convey or to share?
I mean, other than my gratitude for all medical people, what would we be without you? And also just people that are focusing more on the mental health aspect and the relationship that has to your physical well-being. I think that the focus has really started to shift to also destigmatizing mental health and the issues that so many of us are challenged with in that area. And just really happy to see doctors embracing that and not sort of disregarding it or shrugging it off, because it does have a profound effect on people's health.
Yeah, I couldn't agree with you more. As again, somebody personally who over the last 2 years of COVID has experienced my share of burnout, having 3 clinical jobs as a medical director at Housing Works, working at a harm reduction clinic in the Bronx, treating opioid addiction, and working in vaccination sites, as well as doing media work. I was burning the candle on both ends, and it's so important to take care of one's personal, individual mental health and mental well-being and physical, as well as the that of those around you. And when you talk about, say, something like osteoarthritis and the pain and stiffness and the frustration that's surrounded by that's also associated with a lot of frustration and anxiety and depression and all these other aspects that we tend to not talk about. I really can't thank you enough, Jennie, for shedding light on this, for sharing your story, especially using your platform. I mean, people that are in your position of like celebrities have tremendous power and really making a difference, and more than people like me. So, but this is why I like to collaborate with folks like you so we can share this message and get it out there to as many people as possible.
Absolutely. Thank you. Thank you so much too.
Thank
For all
you
that
so
you
much.
do. Oh my gosh, it sounds like a lot. You have a lot on your plate. So remember to take care of yourself.
Thank you so much, Jennie. This was a real joy for me.
I hope you enjoyed my interview with Jennie Garth. She could not have been nicer. I am so grateful to Jennie for opening up about her own experiences with OA, including her initial stigma and misunderstanding of the disease. She thought it was just for old people. But honestly, I believe that by using her platform, she is really going to be able to have a positive impact on so many people who experience similar arthritis symptoms. I also want to add a bit more detail on treatment options. While there is no cure for osteoarthritis, a stepwise treatment approach can be effective at reducing symptoms. First-line treatment for mild osteoarthritis includes exercise, physical therapy, weight loss if overweight or obese, and acetaminophen or Tylenol. NSAIDs, or non-steroidal anti-inflammatory drugs such as oral ibuprofen or naproxen, or even topical agents like diclofenac or Voltaren gel, can reduce pain and swelling from inflammation. Moderate to severe osteoarthritis treatment options include glucosamine, chondroitin, opioids, steroid injection, and possibly joint replacement surgery. So get involved, donate to, volunteer with, and learn more about osteoarthritis by visiting the National Institute of Arthritis and Musculoskeletal Skin Diseases, the American College of Rheumatology, the CDC, and the Arthritis Foundation. Well, that's it for today, but not before your joke of the day arthritis theme. Did you hear that rap star Snoop Dogg got arthritis? His joints were inflamed. I'll see you Monday, 3 p.m. Eastern. Be sure to subscribe to my YouTube channel and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.